Hi, my name is Camila Naritova. I'm from Columbia University Nursing School, and one of the reasons I chose this global site is that I've never been to this part of the world. I've never been to any of the countries in Africa. And another reason is that I wanted a hands-on experience and meet all the nursing students here as well.
Hello, my name is Jennifer Yehevioha, and I come from the Columbia University School of Nursing. I chose to come to Kenya because I have origins in West Africa, and I kind of wanted to see how medicine and nursing and healthcare really is in this continent, because I have interest in coming back and serving this community.
Hi, my name is James Ward, and I'm from the Columbia School of Nursing. I chose to come to Kenya for my integration because prior to joining the School of Nursing, I worked for a global health nonprofit and really wanted to find an opportunity in my nursing curriculum to go back to a lower resource setting and learn from a different dynamic.
My name is Cheyenne Glasgow. I'm from Queens, New York, and I'm currently a student at Columbia School of Nursing in the MDE program. So why did I choose to do a global practicum in Africa? When I found out that Columbia was offering a global practicum, I thought it would be an amazing opportunity. It was really, really important that wherever I went, it was in Africa. I've never been to Africa, but as a Black woman living in America, I thought it was really imperative for me to be able to learn from people that look like me, that identify as I do, and that share similarities in terms of culture. I knew that I'd be able to work with a vast amount of people here at Kenyatta from different tribes and cultures and communities. So that was the reason that I came, and I'm happy that I did.
My most memorable experience here at Kenyatta National Hospital, it was losing a patient that I was caring for a couple of days, and I really got to know the patient, and I've never lost a patient before, and I will never forget that day and what I took out of it and what I've learned subsequently about the dying process here at the hospital.
My most memorable moment at KNH was in the labor ward. I absolutely loved it. I just loved coming in every day and seeing expecting mothers and seeing babies and just helping facilitate them through that journey of giving birth, and just seeing them go through what can be a very painful experience, but also a very worthwhile experience at the end when they see their child with them in their arms.
For me, the most memorable part of this experience has been the opportunity to compare how we deliver healthcare back in the U.S. To what happens in Kenya in a variety of settings. We've mostly been working at Kenyatta National Hospital, which is the largest public referral hospital in Kenya, but we also had an opportunity to visit a rural health outpost in the village of Sirimbe outside Kisumu, and also go to a mental health facility, a large mental health facility here in Nairobi. So I think just the opportunity to compare all those settings to how we deliver healthcare in the U.S. will be most memorable for me.
What has been my most memorable experience so far? I've had a wonderful experience working at labor and delivery. I've absolutely adored working with women who are coming here to deliver birth. The Black mortality rate in America is ridiculous. It's an epidemic. And so to be able to support women as they bring forth life here in beautiful Kenya was very, very powerful and emotional and rewarding for me. So that's been an amazing opportunity and very rewarding since I've been here.
And one of the things I will take with me forever is the relationships that I got to build here with all the nurses and all the staff and doctors, and all the little moments that we shared as I was learning about the hospital care here. Asante sana KNH for having me, and it was an incredible experience, and I will take all the lessons you've taught me along the way as I become a nurse.
What I'll take home with me, I think it's just the teachings. I feel like every single day I've learned so much, and I've built upon all of my skills that I've learned back home, and I've been able to implement them here every single day, second, and hour that I'm with my patients here. I've absolutely loved all the nurses, the students, the staff, the doctors here. They're always teaching me, whether it be medical related or like Kiswahili or like just stuff about Kenya, so I've been very appreciative, and it's been a wonderful, fun, emotional time here, and I'm very appreciative of everything.
And then in terms of what I'm going to take away from this experience, I've just been so impressed by the resourcefulness of the staff at Kenyatta, in Sirimbe, and at the Mental Health Center. I continue to be impressed by the innovation, the creativity, and the resilience of the staff. And those are lessons I'll certainly take back home with me to the U.S.
And what will I take home from this experience? I definitely think that I'm gonna take home kind of just remembering why I came into the field of nursing. I'm a social worker in heart, and I feel like I've been able to work with people who pride themselves on those same skills of loving people, of putting patients first, of supporting patients. And so I definitely think that when I go back home, I just want to continue to remember why I've come into this field, because I've been inspired by the nurses and all of the clinical staff that I've worked with since being here.
My name is Dr. Mundi Lilian, and first and foremost, I thank that Global Partnership for the students that they brought on our way in collaboration with the Colombian students. Actually, we are very, very happy to have them. We've had quality time in the ward. They've been here with us for 6 weeks, and today is their last week. And that 6 weeks today appears just like it was only one day because of the time that we've had with them. They have been actually very active students. I've been so impressed with them. I've been in the wards with them, and they meet the standards. I believe they've learned, and what I could only say is that they may have seen some things which shocked them, because this is a third world country, but we tried our best what we could be able to offer them. And again, they've been allowed an opportunity to do the actual practice on the patients. And I want to say that we are also very grateful to Kenyatta National Hospital for having allowed us to take our student there. I talked to one of the professors from pediatric wards, actually told me she was very, very impressed with the students from the Colombian University, and she even said she would advocate that we have more and more of the programs. So from my mentorship with them, what I saw is that I don't know, maybe the students will evaluate. I know that they have a program, and 6 weeks may have been the maximum period that they wanted them to be. There is a lot to be learned, and particularly in the specialized unit. Though when they came in at any one given point, because of policies, Kenyatta was still streamlining their rotation in the clinical specialized areas because of the many number of students, and I'm glad that they allowed them to rotate in those specialized areas. There is still a lot of experience, and so I would recommend that when they come one time, we negotiate with the operating theaters to allow them to go there. And why I'm saying so, because just 2 days ago we had an encounter of resuscitation, and you see, if they are rotating in accident and emergency, they save minutes, the seconds they save patients' life. So if they are allowed, and we can be able to attest that they have the competency, then they can as well be able to execute that and participate actively in the resuscitation, including the intubation. In our country here, we allow nurses working in the accident and emergency to do the intubation. And so you being an acute department, we would not have been able to allow them to do that. But if they learn it in the theater, for patients who are coming for cold surgery or the general surgeries, not acute patients, then they take their time there to learn how to intubate under supervision of the anesthesiologist or the anesthetist. Then when they go to the accident and emergency department, it will be a great opportunity because that place is very busy, is so demanding, and patients can change condition anytime without any warning. And if you are there and you are able to act immediately, as you call for the resuscitation team to come, then you are able to save a life. That which we did that day when you were in the ward 2 days ago. So that would be my recommendation. Then the others, we will sit down and exchange with the students so that we see where did they feel that they needed more experience. We are going to do debriefing so that we know which areas do we need to improve. And I would urge them not to feel shy to tell us everything that they observed, because it is in good faith that they are doing so, and that will help us. We'll share that communication with the Kenyatta National Hospital, and as a team, we'll be working towards improvement. So even as I'm standing here as one of their supervisors, I'm so happy. Today they gave me clinical preceptorship, and I will remember them with this throughout. And on behalf of the Department of Nursing, University of Nairobi, I want to take this opportunity to thank you on behalf of the chair of the school. She is busy, she's not able to be with us this morning, but she has always been following up. How are you getting on? And I think also she has been having contacts and communication with Natalie, who is their supervisor, Professor Natalie from Columbia. So that is the much I can say. So sad that they are leaving, but I know even where they are going, I'm happy that they will be able to impact lives in Columbia. And I pray that some of you find it fit to come and work with us in Africa. You will be most welcome. We also had a very short time we couldn't take them to our tourism sites. But I believe one time, because they've seen Kenya. Kenya is a beautiful country. Karibuni sana. Asanteni sana. Sana, sana, sana. Yes, we appreciate.
Asante sana, Kenyatta National Hospital.
Asante sana, Columbia Global Center, Nairobi.
Asante sana, Kenya!